Show us how it works.
All right. Well, I'm going to give you a brief overview of the healthcare reform law, how it works, and then I'm going to talk a little bit about what might happen in the next couple of years, and talk a little bit also about maybe some of the winners and losers, and that's really relative, but sort of the winners and losers in some of the healthcare reform. Now, these slides I'm going to show, they have a lot of information on them. Don't try to take it all in. I'm going to hit the high points. So, all right. So, what does the healthcare reform law do? And
we're going to distribute the slides by email tomorrow.
So, the important thing to keep in mind here is that most of the coverage expansions start in 2014. So, not really much is going on right now on expanding coverage. But in 2014, there are two big things that occur. One, they expand Medicaid to able-bodied adults, childless adults, which most states don't cover, up to 133% of the poverty line. And then they above 133% to 400% of the poverty line, which is about $88,000 a year income for a family of four. If you're uninsured, they're basically going to provide you a subsidy to purchase insurance. And those are sort of the two main components of how they expand coverage. Now, included in those are also an individual mandate. So if you don't have insurance, you're going to have to pay a penalty to the IRS. Not an explicit employer mandate, but if you're an employer above 50 full-time employees, if you don't offer health insurance, you're going to have to pay a penalty. Another sort of important point is that if your employer offers you health insurance, in most circumstances, not all, but in most circumstances, you can't get a government subsidy. So you pretty much have to take that. You don't take it, you don't have to. But if you want to purchase insurance in the individual market, the government is not going to help you purchase that. There are a couple of other things that are sort of note. I mean, there was no government option. That got talked about a lot. That did not happen. These health insurance exchanges everyone talks about, they're really going to be just the sort of the marketplace at the state level where you're going to be able to purchase insurance. There's a small employer subsidy. It's not really all that meaningful. So that's sort of the broad brushstrokes, how the expansion works. Now, okay, what does that do for the uninsured population? And you'll see our chart here is the Congressional Budget Office estimate of new coverage. And you'll see in 2014, that's when the expansion really starts. You get 10 million new people in Medicaid, you get 8 million people in the exchanges, and by 2019, you've got 32 million newly insured, about half in Medicaid, half through these exchanges. It's about 95% of the American population if you exclude illegal aliens. So there's always still some uninsured, sort of frictional. Maybe some people decide they don't want it. They pay the penalty. They qualify for Medicaid. They just haven't signed up. But you'll see it starts in 2014. There's a little bit of ramp up, and it goes into full effect. One other thing of note is there is a little bit of employer dropout. You'll see that declines by about 4 million people. And that's employers sort of saying, I'm not going to offer coverage. My employees can go ahead and get it in the exchange and get a government subsidy, and I'll pay the penalty. So all that, of course, costs money, right? I mean, it costs about $1 trillion over 10 years to finance all these subsidies. So how did they pay for it? Well, they paid for it by doing two things, basically. They took reductions out of providers, mostly on the Medicare side, and that did for about half of it. And then they did tax increases. And you'll see that hospitals, of course, contributed about $160 billion, the Medicare Advantage program, home health care, pharmaceuticals, and on down the line. And most of these things, of course, are out of the Medicare payment system. And most of them come from, most Medicare providers get an annual inflationary increase. It runs about 3% a year most years. And if Congress did nothing, that inflationary increase would go into the payments, and their payments would go up by 3%. And the law basically says, for most providers starting in 2012, that amount is going to be adjusted downward by probably 1% to 2%. So if you imagine that they got a 3% update, instead maybe they'll get a 1% or 2% update. And that generates savings, and a lot of savings, hundreds of billions of dollars. And that was the biggest component of the Medicare savings. Now, there were some additional things specific to hospitals, specific to home health care, that are obviously important for any one of those providers. Now, like I said, that generated about half the savings needed. The other half come from basically increased taxes. And they did this Medicare payroll tax. Well, that's really a misnomer. That's what they called it. But it's really an income tax on high-income individuals above $200,000 a year. except they didn't index it. So presumably 100 years from now, everyone will pay it, given inflation. Other tax provisions, really, fees on providers, the pharmaceutical industry, the insurance industry, the device industry. Those were somewhat controversial amongst those providers. Probably the most controversial thing is this Cadillac plan fee, which starts in 2018. If your employer provides you with a very rich health insurance, you're going to have to pay a tax on that, which incentivizes the employer to maybe offer you insurance with a little bit higher deductible, higher copays. Very, very, very controversial. Doesn't start until 2018. It's so controversial. We'll see if it actually goes into effect. There's a lot of Congresses between now and then on that one. So there's one other thing that's sort of important to note about this, too, when you think about it. Why did providers, most of them, support the healthcare reform law? Well, this answers that question. We're taking about $500 billion in non-healthcare spending, and we're putting it into the healthcare system. And so aggregate healthcare spending in the United States is going to be increasing. It's going to go up. We're going to spend more money on healthcare 10 years from now than we would have if we didn't do this law. Obviously that money is going to flow to hospitals, physicians, pharmaceutical companies, and that's why they supported this legislation. So, well, we just had the elections. What does that mean? And there's a lot of, sentences on this slide, but really not a lot is going to happen in the next 2 years. The House will probably pass a lot of bills. There'll be a lot of hearings. But you have a Democrat Senate. As long as President Obama is in office, he would veto anything that would seriously impact the coverage part. There may be some adjustments on the pay-fors, things like that. That wouldn't be too surprising, but that doesn't get at the heart of the legislation. Really, this and, the state lawsuits and stuff, I mean, it's really setting up the 2012 presidential campaign and what happens there. Now, after 2012, depending upon who gets elected, there could be some serious changes. If the president gets reelected, then the healthcare law will probably go into effect as is. If a Republican wins, there's probably a pretty good chance that it may be gutted, and they may do serious changes to it. And it may look nothing like what it looks like now, and that would, of course, generate a whole different situation going forward than what we've outlined here. So, healthcare is always going to be having changes at the federal level. Now, we have this nice little Venn diagram here, and it sort of shows what we think about the sectors of healthcare and how they're operating over the next couple of years. And, really, we have things like under most pressure, like home healthcare, which is taking some pretty significant cuts in Medicare. And, health IT, where the government is spending money to hospitals and physicians to help them adopt health information technology. Now what this diagram really doesn't show is that even though home healthcare is really under pressure, that doesn't necessarily mean it's a bad area to be in or a bad investment if you're going to invest. It means, of course, the price has to be right? You could overpay for a health IT company and it not be picked, the technology not be the one that makes it, and you've lost all your money. Or you could pay the right price for a home healthcare agency or start a home healthcare agency and, you'll do quite fine. But you'll see that, it's the middle ground is really where most of these things are at. And, most of the stuff that's going on here, of course, is related to the Medicare payment system. Is Medicare cutting reimbursement, and how much are they cutting? Well, they're really cutting home health care. They're really cutting oxygen and durable medical equipment. Not so much on the ASC side. Medicaid managed care, the Medicaid system is under pressure. States are going to be looking at putting their populations into Medicaid managed care. Obviously, when 2014 rolls around, there's going to be a big bump up in the Medicaid population. Health IT is huge. Everyone is interested in that. But of course, the question is, what's ultimately going to be the technology that's adopted to have, electronic medical records that can talk to each other? It's a big question. Of course, this is the services side, and we have the pharmaceutical and device side. And once again, this is an issue of sort of where are you at in sort of the government spectrum. And it sort of, varies. Pharmaceuticals in general, are in pretty good place. Branded pharmaceuticals have, of course, supported the healthcare reform law. They're going to make out if it goes into effect. They'll probably get a lot more money back than what they gave up in financing the legislation. Certainly generic pharma, they didn't really have to give up much on the savings front from the government's perspective. And, insured people, if you're uninsured and you suddenly get insurance, you're going to consume more drugs. And there's just no doubt about that. And so they're going to make out. Device manufacturers, and to a certain extent, pharmaceuticals are facing pressure under FDA. FDA sort of goes into cycles, and it's in a cycle right now where, they were perceived as being too lenient to pharmaceutical companies and device makers on approving products, and they're going to be much more harsher and hardcore. That cycle will occur for a while, and a few years from now, we'll probably cycle out of that. But right now, it is in a situation where it is sort of a tough environment. But that being said, that's sort of the overall picture of where we're at. Healthcare, under the healthcare reform bill, does present a lot of opportunities. Like I said, there is a reason most providers supported it. A lot of money is going to be flowing into the healthcare system. But what we do here at Marwood is the political situation can change and the outlook can change, and it's something you just have to sort of watch and follow and see what develops.